Okay, so this is the 16 unit cases from the premolars crown, and the lateral and central is a veneers is great amount of surface texture, the great preparations. This is a mirror image, so you can see more detail about the final work. Alright, this is the 16 unit cosmetic makeover cases from the wax up design, and they make the good amount of a good natural transparency from the incisor 1/3, and then finalize it, the restoration. So basically we make the good golden proportions of the tooth. It's individual the veneers and crowns, and they make this good contour and shaping from the treatment plan wax up. So that one is our aesthetics, and then this bright is bleaching enough, and then give them good information. This is from the before we fabricated the finals treatment plan wax up, and then doctors made it the temporizations from the lower here too. Here's a broke, sorry. It's great anatomy. And then here's another. Dr. Prep did a really nice job. And then this is our finals, the veneers restorations, which is the height of contour, incisor, embrasure, silhouette, and long axis. It's a great tool. And this one is the finals cases. It's like that. We finish up the high-end cosmetic cases. It's another lucky patient. Beautiful artwork from the laboratory. Alright, thanks for watching my video. So I would like to share with you guys that in order to make these beautiful aesthetic cases, it's not only the color and shape and contour. I would like to talk to about all about the design of the cases. Okay, so it's a couple minutes, so stay tuned. What I'm trying to say to you guys, this is the initial photo, which is from the doctor. So we just evaluated, which is treatment plan wax. Sometimes doctor can do the tissue gingivectomy, or some people cannot do. Okay, but that one is a little bit limitation to our final cosmetic. If doctor can do the tissue management, that'd be awesome. That's perfect. And beside that, we have to create the good amount of the shape and contour here. Okay, to make it depends on the patient desires, is rounded or square, rounded like that. So we can make this better. The lateral shape here, canine is pretty good. Okay, so shape, lateral shape. Of course, we can change the color too, to change this a little bit more here too. So then we don't have any problem about the root long axis. This is the main key. So what I'm trying to say, we have to see the lobe direction here, which is all the time, I just talking to all technician, we have to make the symmetry. Symmetry start from major contact area. If we don't match this, we have a problem in distal. Then we have a size problem, and the one side set up the golden proportion. Let's say this is 100, right? And here's the 70 to 80%, 60 to 50, 60%. So this is our concept of the tools, the matching the good contouring. So that being said, this is the before, and this is the lower. Okay, so we prep the teeth, and then let doctors know, prep guide. And also we make the treatment plan wax up, just exactly what I said, just like this here. but this is we call test drive. Okay, so we're going to make the wax after I prep it, wax contouring, and then we can prepare it, and then we duplicate it, okay, and then make stent and send to the doctor, so doctor can make the temporizations. So temporarily they can discuss together what they like about the size-wise and canine, lateral, those kinds of things. So doctors prep it exactly what I said, 3/4 the lower crowns and the upper. And then here is the finals, restorations. So here is the upper, so we made by Lisi, Cosmic Press. Okay. So this is the lingual view, and this is the frontal view. So I utilize more about the deep translucency, which is I using the TMO1, okay, EOP4, TMO3, and then it's a good halo in between the teeth. Just like lifelike restoration, it's not like a shade tab, it's more likely more the natural dentition with the enamel. And not only that, we match the shape and contours, what I present for, okay? So this is long axis. And then an open incisor embrasure. I did not mention about incisor embrasure too. So we can mention about incisor embrasure here, there. So which is another key factor to make this better aesthetics, individualize aesthetic as much as possible. So this restoration is lower, a little bit, more, same thing, other side. You see the side view, okay? That was good. Then you can finish it. Now, we finished the lower as well. The slightly lack of room in this facial area. I wish I can get a better room, but now it's 5/10 millimeter lower. You see, the lower teeth, same thing, but less raspy compared to upper. So this one is another aesthetic restorations can get, okay? And this, so whenever we mount it, the cases, the orgocentric. So that is the best bet for that. With from the before, and then we make the treatment plan wax up, and then I have to make the putty, and then we send to the doctors. So this is the before, right? And then here is the before too, the lower, the occlusion, and then here is the finals, the restorations compared to this. The lower can get the perfect aesthetics for that. So that's why we call this a signature line cases. Let's finish it. Beautifully done. Thanks for watching.
Subscribe to Luke Kahn's Patreon for ongoing training for dental technicians, lab owners, and aspiring lab owners, as well as education from a lab side for dentists. For just $25 a month, you can train with Luke online via live video, live chats, Q&A sessions, and ongoing dialogues on Patreon. Additionally, dentists can get valuable information from a lab side perspective on live, ongoing cases that Luke Kahng is presently working on in his laboratory. Subscribe today